The next entity we're going to talk about is giant cell tumor of head and neck. Basically, I just thinking this is fall into the giant cell tumor category, like giant cell tumor of the bone. They can have share some common feature. So I think if the image show you a giant cell, a lot of giant cell, you may think about this entity. But I just like to remind you that not all the giant cell tumor with tons of giant cell. So you need to remember another characteristic finding really unique for this entity is this mononuclear stroma cell with a monotonous appearance. So I borrowed this image from Dr. Jerry Gardner's channel. I I think he doesn't mind. I borrow this image. Is my great mentor at Gassinger Medical Center. So I think most of you guys already subscribed his channel. So this is the mononucleus histiocytoid cells I want to show. It's really nice. They have eccentric nucleus and then with this eosinophilic cytoplasm, always big kind of some rhabdoid, histiocytoid looking. And then they also have this characteristic hemosiderin deposition. So this is the characteristic of giant cell tumor. If you could not find tons of giant cell, you need to find this mononuclear cell. Another feature is this foamy histiocyte, also support the diagnosis. Then we have this sclerotic stroma, another characteristic finding. And then again, highlight this hemosiderin. So the immunomarker is not really specific, but right now we have kind of specific mutation. This histone 3 protein, we find this gene mutation H3F3A G34W mutation. So let's see some image. Okay, so this is giant cell tumor. So let's see this piece first. Kind of well demarcated mass. So we may think of kind of benign entity. Then for the giant cell tumor, of course, we would like to see the giant cell first, right? So let me find some giant cell. This focal area, even in this power, we all can see this giant cell. But really nicely, we also see our friend, this mononuclear cell. See, they are everywhere, even more than the giant cell. So they have eccentric nucleus, and then eosinophilic cytoplasm. And then when you see the nucleus, put this nucleus into the giant cell, they are the same. So this is giant cell tumor of the bone. What you should recognize is this histiocytoid, plasmacytoid cell, mononuclear cell. And then let's find other feature. Even in this power, we can see this really sclerotic collagen background. Then we have this foamy histiocyte, really foamy looking histiocyte, supports our diagnosis. And then we also like to show you one more feature. I think this is hemosiderin deposition, another feature. And then one more is that sometimes you will see this cohesive mononuclear cell. See, this is also mononucleus, eccentric, rhabdoid, plasmacytoid looking, and then they forming this kind of this cohesive area. So this is another characteristic finding. The example is really good because we can see all of these foamy histiocytes. So if you don't see giant cell, but you see these, you need to looking for these mononuclear cells. So this is a really nice example of giant cell tumor. let's move to another entity. Aneurysmal bone cyst